Good morning. I am my voice is taking a turn for the worse after the last night's duet with Dr. Perez-Cruet. It's a Jimmy Buffett song that's really extended my range. But anyway, so this is my rookie year that I just concluded with Neospine. So, sorry, let me get. So today I'm going to talk to you about a couple of studies that we're doing internally, and also a couple of the other fronts that we're very interested in and sort of pushing the limits in terms of outpatient spine surgery. So one of them is the role of surface technology in fusion rates. Now, most of you who do Wiltse TLIFs, you know that if you don't take down the posterolateral gutters, the patient has a lot less pain. So that can also be applied to a midline approach or a traditional pedicle screw open approach. If you don't take the posterolateral gutters down, patients do a lot better. But you need to focus your efforts on getting a great interbody fusion. So surface technology is something I've been interested in, roughened implants that are porous. They don't need to be 3D printed, but there's a variety of things. There are several companies that have focused on 3D printing, but some have focused on etching and acid washing their titanium implants and creating that porous construct. So we wanted to be industry blind in this approach. So we used a variety of different implants and no BMP, no posterolateral gutters, single 1 or 2 level fusions, and basically looked at ODI, VAS, and the primary outcome we were looking at was formation of trabecular bone across the inner body. And so far, the study's not completed, but so far we have about 85 out of 100 we see trabecular bone. Now, most of the patients are happy, great majority, but we are only reporting the ones that have trabecular bone on fine cut CT. So I'll tell you more about that study later on. So the other thing is I've been a skeptic of SI joint pain for a while, but I've come around. So most of the studies that are out there that you've talked about has been industry sponsored. The SI bone study with Dave Pauly's group, there's a lot of industry approach. We started this study with an industry support initially, but we turned it down and decided to incorporate other manufacturers. The two bigger manufacturers are SI bone and also Globus. So these are patients that have had a fusion. I generally do not see SI pain in anybody who doesn't have a fusion unless they have trauma or they have either pelvic trauma from a fall or post-pregnancy. Those are the only 3 conditions that I've ever seen SI bone, and I would be very skeptical if somebody came to my clinic and said they had SI pain without those conditions met. So we looked at 45 patients over 3 years and followed them up. They're actually 2 years out, so this says 12 months follow-up. But you can see that, I'll show you the results in a second. 20% of them, 9 out of 45, had bilateral fusions. So ODI was pretty good, 41-point decrease in ODI scores, which is very good, and 6.1 decrease in pain scores. So I'm not quite as a skeptic as I used to be, but we've presented that study at several meetings and good reception. So the other thing that we've been doing for since January of 19 to December of 19, we've done a total of 88 total disc replacements in the cervical spine. Our constructs have been 1 level, 2 level, and 5 of them have been hybrids. I'm very interested in hybrid constructs because propagation of fusion happens a lot in patients that I see. So instead of doing a 2nd level fusion or 3rd level fusion, you would put a disc replacement next to it. Unfortunately, Medicare is the only payer to this point that you can do this with. There are several papers in the literature that show normal biomechanics for the disc adjacent to a fusion. So it would be important for us to collect data. This would have to be a multi-center study because we just don't have enough numbers and because of payer coverage. So if anybody's interested, I'm very interested in combining data. So the last thing that I've been interested in is doing outpatient lumbar fusions. What I mean by outpatient is go home the same day. I'm not talking about overnight, 2359. We've been doing that pretty routinely. in the hospital setting, in the HOPD setting. But
hey guys, thanks for watching. To continue, please log in or create an account for free. Thank you for your support.